Good afternoon, teacher. My name is Laila Maya. My topic is lingual papillomas. Definition: lingual papilloma of the oral mucosa is the most frequent papillary lesion and accounts for 4% of all lesions of the oral cavity. 6 clinical HPV lesions are most frequently observed on the upper lip, lower lip, lingual frenulum, back of the lingual.
Avete visto una fibra non
Application in nursing. The treatment is individualized in each case. Destructive techniques such as cryotherapy, electrosurgery, immunomodulatory 5% or antimetabolic that interferes with the synthesis of DNA and RNL.
My name is Dr. Joe Sneezek. I'm a head and neck surgeon at the Swedish Cancer Institute here in Seattle. Throat cancer has recently undergone a drastic and dramatic change in about the past decade. Previously, the vast majority of head and neck cancers of the throat were caused by a combination of cigarette smoking and alcohol consumption. Now, about 80 to 90% of throat cancers are actually caused by an infection with human papillomavirus, or HPV. HPV is a virus that commonly or typically causes warts. The strains of HPV that are linked with throat cancer are usually transmitted sexually, but the time of transmission from infection or exposure to formation of the cancer can often be many decades. Now, the silver lining of this epidemic of HPV-related throat cancer is that these types of cancers tend to respond very well to treatment, with very good survival and cure rates. There are two main ways that we treat these types of tumors. They can either be treated with a combination of chemotherapy and radiation therapy.
Cons. 1. At present, it is not possible to determine that vaccines work completely. 2. Can lose speech. It should apply in Ecuador. Human papilloma affects 5% of sexually active people in Ecuador.
Oral human papillomavirus, also known as oral HPV, is a viral DNA infection that can infect the back of the mouth or the back of the throat. In most people, oral HPV doesn't cause cancer, but in some people it can cause cancers of the head and neck, particularly cancers of the tonsil or the base of tongue. So the HPV vaccine was designed to prevent anogenital cancers and to prevent anogenital warts. We don't know what the effect of the vaccine is against oral HPV or HPV-related cancers of the head and neck, but we think that it will help reduce the burden of HPV-related cancers in the United States. So the HPV vaccine is known to have high efficacy in reducing cervical HPV and cervical cancer. Most head and neck cancers that are HPV related are due to one type, HPV-16. HPV-16 is included in the vaccine.
Conclusion: the vast majority of human papillomavirus are successfully tracked by our immune system, although sometimes the virus manages to avoid controlling it.